According to a landmark study from the Centers for Disease Control and Prevention, more than a third of high school students say they experienced poor mental health during the COVID pandemic. 44% of them said they continually felt sad or hopeless during the past year. I recently met with Holt senior Zoran Bricky, who shared his story of how grief and the pandemic rocked his world and how his support system helped him get through it all.
It's easy to kind of put up walls, especially in a social setting like this, and act like you're happy, but I think everyone has issues that they're working through at all times.
Zoran Bricky knows this feeling all too well, having lost his father to suicide during his sophomore year at the start of the pandemic. His world turned upside down. One of Zoran's teachers, Aaron Umstead, checked in with him when he was having a rough day. He opened up and shared with her that at times he had an overwhelming feeling of emptiness.
I knew that I was in a bad place, but my friends would always be there to talk to me. The teachers would always be there to talk to me. My mom. I think the hard part is for the student to actually approach someone in a vulnerable state and say, I need help.
According to the CDC, when students like Zoran have a sense of being cared for, supported, and belonging at school, compared to those who did not, they were significantly less likely to seriously consider attempting suicide or attempt suicide.
There's several places around our district, our state, the country where we're seeing that students in school are bringing their trauma with them, and it's our job to rise up and meet that.
Thanks to teachers like Miss Umstead and a sense of community, Zoran has found meaning in life. He is a scholar athlete with a 3.7 GPA with a leadership role on the Holt lacrosse team. He's headed to Western Michigan University in the fall to study finance, a path just a few years ago he never thought he would be on. But because of his resilience, he overcame many obstacles and now looks back and says,
no matter how big or small the problem, it's a lot to bear on yourself if you are doing it alone. So I think it's important to be able to share and open up and let someone else take some of that burden.
Nationwide, there's been discussion around the mental health crisis that would come in the wake of COVID, and now the trends are showing up in the classroom.
And is that because students were alone? Is it because they had to contemplate and face death? Was it experiences that happened to them during the pandemic? Maybe they were in homes they couldn't get away from, if there was the danger element in the home.
The CDC says the pandemic has created traumatic stressors that have the potential to further erode students' mental well-being.
Maybe you had problems before that you didn't get a chance to talk about, and we're all growing as humans. These 3 years that we kind of missed out on, pretty influential in our lives.
In fact, data also shows more than a third of students said they experienced racism before or during the COVID-19 pandemic. The highest levels were reported among Asian students and Black students and students of multiple races.
My students of color, I've been in listening to them and hearing them, there seems to be an uptick of not only feeling alone, but there's been an uptick in language around around the differences of race and hurtful language.
The CDC's data also reveals that lesbian, gay, and bisexual youth and female youth reported greater levels of poor mental health, emotional abuse by a parent or caregiver, and having attempted suicide than their counterparts.
When a person is hurting, that they reach out and sometimes want to spread that hurt unless they're taught and have good experiences with lifting people up.
Some kids definitely struggled. Maybe more than others, but I think we were, as a class, pretty open about it, and we were all there for each other.
Zoran says he leaned on his strong support system that's been with him every step of the way, and for him, it was the difference maker.
If I can get through this, I can get through a lot more, I think. So kind of put a positive outlook. Just to remember to cherish the things you have while you still have them.
The more times we can recognize them for the good work they're doing, the more we're going to find that people blossom, much like Zoran has, into leaders.
And we want to thank Zorn for trusting us to tell his story. And as we've said, he is not alone. From mass shootings to the pandemic, these past few years have been difficult for everyone, especially for teens and young children. So here's what state leaders are doing to try to help. Governor Gretchen Whitmer was in Pontiac last month discussing school mental health services with students, parents and teachers and mental health professionals. She talked about a $361 million investment in school-based mental health services as part of her 2023 school aid budget. Of that money, $150 million will help train teachers to recognize when a student is struggling and to get them help. $120 million would go to schools so they could hire more counselors and mental health professionals. $25 million would give every school free access to mental health screeners who could also lend a helping hand. And $11 million would open school-based health centers in areas that have limited access to mental health care. Governor Whitmer says her proposals will give kids the help they need.
We always have this tendency to say kids are resilient, and they are. But our kids have been through a lot, just like every one of us has. And recognizing to get our kids back on track, we've got to meet their needs. And it's their physical needs, hunger, or it is their mental health needs. It is all equivalent.
The governor's recommendation would include opening 40 new clinics for students across the state. And last week, the state school superintendent and the director of Health and Human Services were in Potterville to help raise awareness about the importance of students' mental health and to lobby for those budget proposals. They say the plan helps meet the needs of our children's health and safety.
A school infrastructure that provides multi-tiered systems of support, mental health screening, evidence-based practices like capturing kids' hearts, social and emotional learning more broadly, data, and funding. Again, funding is critical. It is absolutely necessary, but it is not sufficient.
Now, they chose to visit the Potterville Elementary School because it's one of just 300 schools across the country that was named a Capturing Kids' Hearts National Showcase School because it's created an environment where students feel safe and connected.